Hello and welcome to Medical Dialogues Journal Club. I am Dr. Nandita Mohan, and today I will be discussing a recent review article that is published in the Indian Journal of Musculoskeletal Radiology, that is in turn published by Scientific Scholar. Now, I'll be talking about the World Health Organization classification of bone tumors, that is the 5th edition, what a radiologist needs to know. Now, since 1967, the WHO, that is the World Health Organization classification of tumors, is regarded as a reference standard and a practical guide, and also provides a very precious resource not only for histopathologists and oncosurgeons, but also for radiologists who are primarily involved in cancer care. Now, primary bone tumors are a rare and a heterogeneous group of neoplasms that have a broad spectrum of morphological, biological, genetic, as well as even radiological features. Appropriate imaging, workup, and accurate histopathological diagnosis are often considered to be very crucial for appropriate management and prognostication. Now, the 4th edition of WHO classification of tumors of soft tissues and bone was introduced in 2013. Now, to talk to us in detail about the 5th edition of WHO classification of bone tumors, we have with us today the lead author of the article that we're discussing today, Dr. Sonal Saran, who's from the Department of Radiodiagnosis, All India Institute of Medical Sciences, Rishikesh, Uttarakhand, India. Welcome to Medical Dialogues, ma'am. We are really happy to have you on board here with us today.
Thank you, Dr. Nandita, and I feel really very nice to join this forum.
Great. So, ma'am, firstly, thank you for agreeing to discuss your recently published article, that is World Health Organization classification of bone tumors.
Okay.
And firstly, if you could just tell us, how was your experience as an author writing the engaging article, and also subsequently getting it published in the Indian Journal of Musculoskeletal Radiology? How was your experience?
So basically, Indian Journal of Musculoskeletal Radiology is our official journal of Musculoskeletal Society of India. And I always wanted to write a very good, engaging article for the journal. And as it belongs to the society and I'm a member of the society, so I thought that I will write something like which is of interest for everyone. So basically, the idea came in my mind when I went through WHO classification of bone and soft tissue tumor 5th edition, and I saw that there are some articles on soft tissue tumors for the radiologist, but there was nothing much for radiologists in case when we talk about bone tumors. So I did literature search, and I saw that there is no article as such which is discussing what a radiologist perspective for the 5th edition of WHO classification of bone tumors. So that's when I thought that I will write a pictorial review or a review article kind of thing on this.
Great. Thank you for sharing your experience. So if you could just give us the reason or the rationale for you or your team to have conducted this study and the article, and also its overall clinical significance. You just mentioned that there was in the 5th edition articles that you were going through, there were a lot of soft tissue in terms of soft tissue classification was included, but nothing was included in terms of bone. So what are your key takeaways to fellow clinicians or researchers in your clinical domain specifically, and also the generic readership basis? What is your takeaway message? Anything that you would want to say?
At my setup, at my institute, we get a lot of tumor cases. So it's a tertiary setup, and we deal with a lot of bone tumor cases. So I already had a lot of cases of bone tumors, but I did not know what to do, and I used them for teaching purpose and conferences and all. But I wanted to use them for use them in an article also. So I thought that it's a good idea to show whatever interesting cases that I have, plus something new which is not being published. So that's when this idea came. And since last WHO update in 4th edition 2013, and 7 years have passed, and the latest classification came in 2020, and this article was published I think in 2022 end. So for 2 years there was no such thing published. So that's when I thought, okay, I should actually write a article on this.
So, any key takeaway message that you would want to give out to fellow radiologists, or for increasing your readership on this article? Any key takeaways that you would want to say out?
So basically, a part of article also discusses on how to approach a bone tumor. So this is basically for residents, that when they encounter a bone tumor, how they can classify it. So that flow chart which I have included in my article is very interesting, and you can refer to that thing. And when we talk about the classification per se, so I have described the classification in a table, and it includes all kind of bone tumors plus what is new. So there's another table in that, in which you can find out what were which tumors were removed, which were reclassified, and which were added. So it's like, and I have also summarized key radiological and clinical findings of some important tumors which were newly added and recategorized. And you can also go through that lot of cases, imaging findings and imaging cases I have added with histopathological findings. So that's one thing. And there is one table which differentiates chondroma from atypical cartilaginous tumor and chondrosarcoma grade 1. So that is one thing which is very important for, I think, residents, because this can be asked in their exams and all.
Okay, great. So lastly, if you could just lay out your experience as an author, interacting with the editorial team of Scientific Scholar, and also subsequently getting your findings presented to a larger spectrum of audience via Medical Dialogues. How has your experience been?
So I have submitted articles in many journals and published in many journals, and I've used many platforms. So I found this platform very user friendly, and it was not very tough task to submit article in this, and so it was like very smooth task. And even when my article was under press, and they wanted some changes or some minor corrections, so editorial team directly contacted me, and there was no problem in contact and anything at all. So it was like very user friendly and very smooth process.
Great. So thank you so much, Dr. Sonal. Thank you for giving us your valuable insights, and thank you for giving us your time today. And it was lovely to be interacting with you.
Completely my honor. Thank you.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.